Please.
Yeah.
Good morning. Thank you for the opportunity. We present a rare case of bilateral spontaneous suprachoroidal hemorrhage in a 2-year-old child with clotting factor deficiency and seizures. So suprachoroidal hemorrhage is a rare but potentially vision-threatening pathology. It occurs when blood from the usually the short, but also sometimes the long ciliary arteries fills within the space between the choroid and the sclera. It can be seen in cases of coagulation disorders as a spontaneous event, but that is extremely rare. Here we present a case of a 2-year-old boy diagnosed to have deficient factor 8, factor 5 and 8 with suprachoroidal hemorrhage bilaterally. So he was initially admitted in the ICU of the pediatric department to rule out the presence of retinal hemorrhages because he had rashes all over his body and other other manifestations of the factor deficiencies. He was brought with multiple bruises, fever and altered sensorium with seizure history 6 months back. Incomplete immunization and a birth history of consanguinity. The vision and extraocular movements could not be assessed. The child was in extreme pain and altered sensorium. The anterior segment was within normal limits. On dilated fundus examination, on the first day of the ICU admission itself, the child had bilateral suprachoroidal hemorrhages, which were seen as dark mounds, and this was present along with mild vitreous hemorrhage in the initial days. Now, the child was already under intensive care and was given blood transfusions as well as fluids. On serial examinations, the hemorrhage progressed to dense vitreous hemorrhage both the eyes, and as the patient was not systemically stable, continued observation along with bilateral B scans were done. The pediatrician did not advise steroid or IOP reduction drugs at this time. Over the course of the month, the repeated B scans showed retinal detachment of the left eye, while right eye only had mild vitreous hemorrhage, dense vitreous hemorrhage which was resolving. So this was the profile on CT scan of the brain's intracerebral hemorrhage. CSF profile was normal. Clotting factor deficiency on repeated testing came to be factor 5 and 8. Again, initially because of the blood transfusions, this was not detected. So over a period of 2 weeks, we got the diagnosis. The vitreous hemorrhage along with the RD was noted in the B scan image. So this was the B scan image when the RD was noted. The mobile vitreous echoes in the right eye with complete mobile vitreous detachment with no evidence of RD, but the left eye showed bullous fixed retinal detachments. And as compared to the previous scans, there was a reduction in VH with the development of left eye retinal detachment. So management, the ICU pediatricians had already given FFP as well as the blood transfusions. The patient was managed conservatively for the right eye and underwent a surgery for the retinal detachment of the left eye after explaining the guarded visual prognosis. Sadly, due to the logistic issues, the availability of the backup as well as the factors for the blood products, the surgery was delayed and did not have a good prognosis even after a silicone infusion. It is an extremely rare event, risk factors being vaguopathy, systemic hypertension, increasing age, decompensate liver disease, aphakia, glaucoma. But in this set of patients, it has not been reported. It's almost never been reported spontaneously. Only one case report that we could find was in a 13-year-old with idiopathic thrombocytopenic purpura. Even that patient had a very poor prognosis. Because of this, we had to explain the parents of the grave future complications. It is a rare event, but we could not do much in this case.
What was the time duration between presentation and actual surgical intervention?
2 months, ma'am.
2 months. Okay.
So do you think this was a rhegmatogenous RD or was there a hemorrhagic retinal detachment? Because ultrasound shows a lot of echoes behind the retina.
Probably so it was a combined mechanism because the dense vitreous hemorrhage with the slow resolving, it has been proposed that it causes breaks as well as the tractional component, and the vitreous hemorrhage never resolved completely. Even in the better eye, it is always still a component remaining.
Was there any relation to the seizures he had? Any injury during seizures?
Not that the parents or not that we could elicit on history, sir.
Because otherwise you start thinking of something like a battered baby also.
Exactly.
No?
Yes, we definitely ruled that out. So like we involved the psychiatrist also from our hospital as well as the pediatrician. But the parents were not, they were not aware of the condition itself. It was more of neglect rather than battered.
Fine, thank you.